Hey, everybody. It is a Belle Let's Talk day. Now, this might get a little bit saucy, a little bit salty. So I'm going to warn you. Got my Arate shirt in the mail this week, actually, though. So Arate, what's up? But I got something on my mind, and I'm just going to share. I just want to share with you guys how I'm feeling, because I'm feeling like fire about Belle Let's Talk Day. For those of you that don't know me, my name is Colleen Tatum. I am in Canada. Belle Let's Talk Day is an initiative in Canada where Bell, which is a phone company, people retweet and mention them on Facebook, and then they donate to mental health. And the idea is that they are working to end stigma around mental health, because it's still a thing, peep. It is still a thing. People think that mental health a lot of times is someone being lazy or someone not having the will or the drive or all these things. And so there is a need to end stigma. But it is time to get beyond talking. It is time to give people access to real quality health care surrounding mental health. Tweeting and saying, call someone, call a 1-800 number, there's help out there. I'm sorry, but it's bullshit. I'm sorry if you have kids in the room. I told you this was going to get salty. A 1-800 number is the equivalent of thoughts and prayers when someone shoots up a school. A 1-800 number absolutely helps people, thousands of people, millions of people a year in that moment. But what is next? Have you ever tried to get mental health support for yourself or someone that you love? Because I have. And it's hard as hell. There is not enough access, and it's not because the doctors that you're dealing with and the schools that you're dealing with are not trying to help. They are doing their best. They are usually overworked. They are working far more hours than they're being paid for. They're calling you at 9 o'clock at night on a Sunday because that's the only time that they can try and catch up with the workload that they have, because they know that your person, your family member, your child is suffering on the other end, and they are trying their darndest to help them, but there is not enough access available for them to actually help your child or the person that you love or you. There is not enough access. There is not enough dollars being spent. There is not enough prevention. There is not enough health care being provided to people that need support. And so we can talk about it, but I think it's time to get past ending stigma, and let's have a real conversation about what healthcare looks like in Canada and beyond, and what that means for people that need support. I didn't really realize it, but I have a person in my family. They are my child. They deserve to have a healthy and productive life, but there is not enough help for them. And so when you go to get help, you're faced with a wait list of maybe a year or more. I called one place and I said, what if my child was suicidal? And they said, well, hopefully we could see them within 30 days. Hopefully we can see them within 30 days for a suicidal person. People, this is wrong. If my child had cancer, I could put a picture on Facebook. I could get all the help. I could get all the accolades. I could get a GoFundMe. But when your child has mental health problems or has other needs that are neurodiverse, there is little to no help for them. You are left holding the bag. You are left trying to figure it out. You are left in crisis, and the support that is there is not enough. And if you're in Alberta, our government is trying to reduce it even more. They are trying to reduce care and support to children and people that are vulnerable and make their life even worse. Who does that? If my child had cancer, would you ever deny them care? If my child had to wait a year to get cancer treatment, to even be seen by a cancer doctor, you better believe that there would be some media attention surrounding that. You better believe that there would be some people marching in the streets to make sure that people had access to the care that they deserve. So why, when it is mental health or autism or another disability, why is it okay to leave these people waiting with inaccurate or non-existent care for months and months and years and years? So thank you for joining me. Thank you if you've made it this far. It is time that we talk and we be real and we actually start to get beyond thoughts and prayers and retweets. It is time to properly fund and provide access to quality care surrounding mental health and other neurodiverse disabilities. It's time. I hope that you agree. I hope that you will write your government. I hope you will share this video. I hope you'll write your comments below of your experiences, because we need to talk and we need to change this, because it is not okay and it is time. Thanks, y'all. Have a good day.